The news day continues here on One News Now. I'm Riza Diaz. With more Filipinos getting fully vaccinated against COVID-19, the government eyes the issuance of unified vaccination certificates. Let's get more details on this. Faith Del Mundo is reporting to us live from Quezon City. Faith, can you tell us exactly what is a vaccination certificate and for how, and is this different from a vaccination card?
Yes, Riza, the Unified Vaccination Certificate from the Department of Information and Communications Technology is said to make travels more convenient as it is internationally recognized. This is in contrast to vaccination cards that are distributed by local government after a person receives a job. In the Laging Handa public briefing today, Information Undersecretary Manny Caintic said the vaccination certificates will be based on data from local government units. But Caintic clarified while vaccination cards prove that a person has been inoculated, a vaccination certificate is proof from the national government that it is especially used for international travel. He said the vaccination certificate is aligned with the World Health Organization and International Air Transport Association standards. These standards are also followed and recognized by countries around the globe, such as the United Kingdom and European Union. The official also assured that unlike vaccine cards that may be easily duplicated and unified, vaccination certificates will be secured and encrypted. Among its security features are private key encryptions that are hard to reproduce and replicate. Caintic also said that informations of up to 70 million Filipinos or the government's target number of people to be inoculated to achieve herd immunity can fit the database system and will not lead to a server issues. The vaccination certificate is also expected to be convenient to use and easily verifiable, even if ports of entry and exit go offline. Caintic explained public key will be given to verifiers where verification may be done even without an internet connection. The DICT is also planning to launch a mobile app where a fully vaccinated person can access his or her personal QR code. Riza, the DICT is calling on LGUs to submit the list of individuals as soon as possible or by July 31. This is so that they can start issuing vaccination certificates by August this year. Riza?
Faith, just a few questions. What about Filipinos who were vaccinated under their employers?
Yes, Riza, private firms that conducted their own inoculation drives are asked to turn over their list of vaccinees to their respective local governments units. Riza?
All right, thank you. That was Faith Del Mundo reporting live from Quezon City. Now, what do we know so far about the highly transmissible Delta variant? And how do we mitigate the risks of getting infected? Let's find out in this video from the World Health Organization.
So the Delta variant is a variant of concern that WHO is tracking and monitoring around the world. It's a variant of concern because we know it has increased transmissibility. This has been demonstrated by several countries, and we know that where the Delta variant is identified, it really rapidly takes off and spreads between people more efficiently than even the Alpha variant that was first detected around December, January 2021. As of today, the Delta variant has been reported in 96 countries, and we expect that the Delta variant will continue to spread. There are a number of factors that are contributing to increased transmission around the world. The first are these variants of concern, including the Delta variant. The second factor is that we have increased social mixing and increased social mobility, which increases the number of contacts that individuals have. The third factor is the relaxation or the inappropriate use of public health and social measures. Proven public health and social measures that we know prevent infections, reduce the spread of somebody who is infected with the virus to others, and save lives. And the fourth factor is the uneven and inequitable distribution of vaccines. The world remains largely susceptible to infection, including any variants of concern, including the Delta variant.
So Maria, different countries of the world are in different stages of this pandemic. How can we assess our risk wherever we live to protect ourselves from the Delta variant?
So this is a very important question Knowing your risk helps you to take the measures to lower your risk every single day. There are many things that you can do yourself that can keep yourself protected and keep your loved ones protected against this virus, including the Delta variant. This includes making sure you have clean hands and wearing a mask, making sure that mask covers your nose and your mouth, and that you have clean hands when you put on your mask and you take off your mask. It involves avoiding crowded spaces, keeping your distance from others, making sure that if you are indoors, you are in a room that has good ventilation. And in many respects, that's as simple as opening a window or two windows so that you have good airflow. Taking all of those measures will reduce the possibility of exposure to the virus and reduce the possibility of you getting infected. In addition, when it's your turn, get vaccinated. We know that the vaccines are incredibly effective of preventing severe disease and death. And so when it is your turn, make sure that you take that opportunity and you get vaccinated and you get the full doses. If you are required to get 2 doses, make sure you go back for that second dose so that you could be fully protected against severe disease and death.
Now, here are other stories from around the world. Rio de Janeiro officials will limit attendance at the Copa America final between Brazil and Argentina at the Maracana Stadium. Only 6,500 spectators, or 10% of the famed stadium's capacity, will be allowed entry. More specifically, only those invited by South American Soccer Federation will be allowed to attend the final. All attendees will also be required to present a negative COVID-19 test before entering the stadium. Cuba has approved its homegrown Abdala vaccine for emergency use, becoming the first Latin American COVID-19 jab to reach the stage. The country's health regulator gave the go-ahead after Abdala's makers announced that the vaccine candidate was more than 92% effective at preventing COVID-19 disease after 3 doses. Prior to this, the country already began immunizing its population using Soberana 2 and Abdala even before they received approval. And in the United States, students and teachers fully vaccinated against COVID-19 won't need to wear masks in classrooms when school resumes in the fall. The new guidelines, or the new guidance rather, follows the recent federal approval of the Pfizer-BioNTech COVID-19 shots for Americans aged 12 to 15. Last May, the U.S. Centers for Disease Control and Prevention announced that vaccinated Americans could drop masks. However, the health advice for schools was not immediately changed accordingly. Meanwhile, state volcanologists continue to detect earthquakes in Taal associated with magmatic degassing. In its volcano bulletin for the past 24 hours, Phivolcs observed 8 volcanic earthquakes, including tremor events having durations of 1 to 2 minutes. The agency also noted low-level background tremor that has persisted since July 7. Taal Volcano remains under alert level 3, which means magma extruding from the main crater could drive explosive eruption. The Batangas Incident Management Team clarifies that there's no mandatory evacuation for areas within the 14-kilometer Taal danger zone, at least for now. This came after a supposed notice saying residents of living in the areas must evacuate immediately circulated online. The Batangas Public Information Office said the Interior Department has yet to release any official statement regarding the matter. The LGU called on residents to be alert and wary of spreading information amid the ongoing crisis. Now, the recent activities of Taal have caused alarm to the public, especially those residing nearby. What does history tell us about the volcano and its previous eruptions? Mobile journalist Jacob Lazaro gives us a front seat to the story.
On Thursday, Taal Volcano had 5 small phreatomagmatic eruptions. That's when large amounts of water mix with magma to produce an explosion. Phivolcs warns that a stronger eruption could happen anytime.
Volcanic eruptions are mainly driven by volcanic gas talaga. At great depths, volcanic gas is combined with magma. No, naka-dissolve siya. However, there will be changes, no, in the magmatic system, which will, in the beginning, allow the gas to separate or flow out of the magma.
During the separations, bubbles will form inside the magma that pushes the magma upwards to the upper levels of the volcano, which causes eruptions. These days, scientists are able to predict a major eruption and its intensity. Experts say there are often signs that precede a major eruption, and these are what they're looking for now in Taal. For example, the frequency of earthquakes.
Nakita namin na maraming times na yung swarms ng low-frequency volcanic earthquakes, they are associated with yung upwelling.
Another potential sign, fish kills, because of the increased volcanic gases in the waters.
Yung agitated ng lake. So makikita mo, nag-ripple yung surface, agitated siya. So ibig sabihin may lumalabas, no? May lumalabas sa ilalim kasi
According to Phivolcs, in the last 449 years, Taal erupted 24 times. The 1965 eruption is burned in our memory as the worst case, after it killed almost 200 people. But it's actually just a moderately violent eruption. The 1754 eruption lasted for 7 months and is seen by Phivolcs as the worst for Taal.
it's not clear kung maraming umalis o maraming namatay sa sa Balayan province. But the population more than halved.
In fact, Batangas used to be called Balayan Province, but the Spanish government changed the name after several towns were buried under 40 inches of ashfall, and whole communities were decimated by fist-sized volcanic rocks. But Phivolcs says the current eruption is not anywhere near this, as the eruption today is only caused by the residual magma left by last year's eruption, and assuming no new magma arises, Taal Volcano's alert level will not rise to level 4 or higher. I'm Jacob Lazaro, and we are One News.
Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.